Well, temperatures continue to rise and the risk of heat-related illness remains a risk in Southwest Florida. According to the CDC, extreme heat causes more deaths each year than hurricanes, lightning, tornadoes, earthquakes, and floods combined. Over 60% of the cities in the Southeast are experiencing worsening heat waves, which pose dangerous health risks, especially for children, the elderly, and for people who work outdoors. As WGCU's Jennifer Crawford reports, understanding how heat impacts your health can save your life.
On a sweltering August day in Southwest Florida, 32-year-old Marco Antonio Hernandez Guevara collapsed working in a farm field. The husband and father of 3 girls was taken to a Naples hospital and placed on life support. He died several days later. Speaking through an interpreter, Marco's wife says she believes working in the heat caused his tragic death.
I lost my partner. My daughters lost their father. And it's a sorrow that will remain in the family.
A recent report by the CDC states hot weather contributes to or causes the deaths of more than 1,200 people every year. Cape Coral Emergency Room Doctor Timothy Doherty explains how heat can turn deadly.
There was an old commercial when we grew up.
This is drugs. This is your brain on drugs.
And they would drop an egg onto a frying pan. That is what happens with heat stroke. Your brain is full of protein. At 105 degrees, your proteins of your brain start to gel and break down. The cells of your body start to break down. Your muscles of your body start to break down. That all gets into your bloodstream. That clogs the kidneys. So you can end up with liver failure. You can end up with kidney failure, in addition to strokes.
Dr. Doherty says the spectrum of heat illness begins with mild impacts.
It starts with like heat cramps. So you get a side splint if you're running, and you just rest, drink some Gatorade, you're fine. Then there's heat exhaustion. Now you're getting lightheaded, now you're getting weak because of the orthostatic blood pressure goes down and you pass out. Nausea, vomiting usually is involved. Those patients, sometimes they can be treated at home just with Gatorade, but many times they come to the emergency department and we start an IV.
He says the extreme end of heat illness spectrum is heat stroke, classified in 2 categories.
The first type is the classic heat stroke. That's the heat stroke that normally little kids get or the elderly get. They come in because they either are too young and their body hasn't developed a way to dissipate heat, or they're elderly and they're on medications that prevent them from doing so. They usually aren't sweating. They're confused, again, coma, seizure. They're the ones who are great at risk of dying.
Dr. Doherty says the second kind of heat stroke is exertional or exercise-induced.
They come in profusely sweating, mental status change, seizures. They're the firefighters that are creating more heat than their body can dissipate in a very short period of time. We also see that in laborers up on the roof, high schoolers playing football with all their athletic gear on, but that also comes potentially with significant risk of death. But you can usually treat them very quickly.
Concerned about how extreme heat impacts firefighters, the Bonita Springs Fire Department implemented a new heat policy.
When the heat index reaches 110, we stop all outside training for that time.
Chief Greg DeWitt says they receive alerts similar to lightning alerts to their phones when the heat index hits 110.
It's all about firefighter health and safety, so we need to be there for the public. So above 110, it makes the firefighters, especially in their gear, more susceptible to heat cramps, heat exhaustion, heat stroke.
On the day Marco passed out working in the field, the heat index in the area hit 112. Health and public safety experts hope that by increasing awareness of the impacts of extreme heat on health, more protections can be put in place and fewer lives lost. For WGCU News, I'm Jennifer Crawford reporting.
Dr. Doherty says while he sees an increase in heat illness and heat exhaustion cases in Cape Coral, there are fewer cases of the more severe heat stroke. Thanks for watching. We've got more great content for you, from news to the arts to the environment. So be sure to like and subscribe to WGCU's YouTube channel and follow us on our social media platforms for the stories that matter to you.